Hi, my name is John Consalvi, and I'm the CEO of LinguaHealth. I'm here today with Dr. Kathy Konert from the University of Minnesota. She's a professor emeritus, and she's taking her time to chat with us a little bit about bilingualism and speech-language pathology. Dr. Konert, thanks for coming.
Thanks for having me, John.
Dr. Konert, the ability to communicate in two different languages is, in general, considered an asset in our society, isn't it?
Yeah, it is. That's precisely why most of our universities, many high schools require second language learning for typically developing monolingual English-speaking children because there's known educational, vocational, social advantages to speaking more than one language. There's also now a fairly robust literature indicating some specific but significant cognitive advantages for bilingualism as well. Now, for children who speak a language other than English at home or a minority language, so in the United States they speak Spanish or Urdu or Arabic or Somali at home and English in the community and at school, bilingualism is the advantages of bilingualism is even greater because for these children, one language, English of course, is for academic and vocational success, but the other language is for social, emotional well-being, for connections with their culture and with their family. So yeah, for these and a lot more reasons, bilingualism is considered to be a good thing.
The question is always raised in our profession, what about students that actually have a speech or language impairment? Can they become bilingual? What are some of the things that parents or professionals need to consider with this population?
Yeah, it is a big question that's often raised because the idea is that for children with speech or language impairments, one language is hard, so the logical leap is that two languages must be too hard. In reality, one language is hard and two languages are hard as well for children with speech or language impairments, but not necessarily harder. We have strong evidence now that show that children with autism, hearing impairments, who stutter, who have childhood apraxia of speech, or who have language or learning impairments can be bilingual. They can and do learn two languages. The key is that we must provide kind of robust, rich support for both languages. But children with or without communication impairments certainly can become bilingual. Then the next question is, how can we support this?
Well, I guess my question is, how can we support this as professional speech-language pathologists working with these students?
First and foremost, the professional has to assure parents that it is okay. Bilingualism, just as it is a resource for typically developing children, it's also a resource for children with speech or language impairments. So reassuring them, it's not trivial because many times parents hear from allied professionals or even from speech-language pathologists that when their child is diagnosed with a speech or language impairment, they need to pick a language and stick with it, and preferably English. And this isn't the case at all. So we need to help, as professionals, we need to help parents understand that two languages is not only possible, but it's a good thing. So that's first and foremost, is helping parents understand the literature that shows bilingualism is a good thing, it's possible, it's doable. Next, we have to identify resources and opportunities for shoring up that first language, and sometimes this is tricky because for languages like Hmong or Somali or Urdu or even Spanish in some parts of the country, there aren't a lot of opportunities for interacting with rich sources of language in the media or with conversation or communication partners or with literacy. So we can help parents identify those opportunities and children identify them and sometimes construct them ourselves to help them. And then we can also try and identify ways that we get these twofers, what I call them, where we actually intervene or do activities that support one language, but in effect it translates the benefits of improved performance in that language actually generalized to the other language. So thinking of areas where those two languages overlapped or interact and doing translation tasks back and forth, home and school programs, things like this. So there's now a lot of resources to help speech-language pathologists, and there's a lot of resources to help speech-language pathologists help parents understand that two languages is doable and a good thing.
So Dr. Konert, what are some of the biggest challenges to supporting two languages in bilingual children with communication disorders?
Yeah, it's easier said than done, and I'd say there's at least four fairly formidable challenges, and one is institutional and individual opposition to the idea. And this comes as agencies, sometimes from the administrative level, sometimes from the professional level, that they feel one language is better, and occasionally from parents as well. So this idea of agency and individual opposition to the idea. A second one is just the sheer fact that we don't have enough bilingual speech-language pathologists in the country. So there's often a mismatch between client languages and clinician languages. We have many times an English-only speaking clinician is providing services to children who speak Russian or Spanish or Somali or some other language at home and English. So this mismatch between client and clinician languages. A third, I think, formidable challenge is, and that's related to this, is that there are fewer opportunities to develop and fewer treatment materials available and fewer opportunities to develop some languages in the United States. So like again, Urdu or Somali or Hmong and even Spanish. So there aren't as many materials available for clinicians to use. And then a fourth challenge is that the evidence base is really fairly weak in terms of vetting which treatment is better when we're trying to support two languages. So this idea, this understanding that we want to support two languages is great, but for clinicians who are trying to engage in evidence-based practice, the external evidence base is fairly limited still.
Well, I think back to when I started in the early 1990s, what was available, what information was available compared to now. I think in a lot of ways we are more prepared for these issues.
I think light years. To that point, John, well, you've done a lot of work in this area and a lot for educating the public, but I think one of the biggest things that's changed, and I hear it more and more now, is that this switch from which language to how do we is happening a lot. So instead of which language do we support, how can we support both languages? And it seems like through a lot of this information that you're getting out there, people are asking that, and where there's this collective will, there are lots of ways. So I do think it's possible.
Dr. Koner, there are some families that when they have a child that has a communication, speech or language impairment, they actually resist communicating with the child or teaching that child that home language.
Yeah, this does happen sometimes. So, for example, a well-informed speech-language pathologist who is knowledgeable about dual language development is discussing with parents a child who was diagnosed with autism or with apraxia of speech or with a language impairment, a late talker at 2 or 3. And the clinician recommends that parents continue to speak their home language so that, for example, they continue to speak Spanish at home, even though the community language is English in the United States, but that they continue to support and develop Spanish at home, and then proceeds to help design a program that will support both languages. And parents resist, and parents say, no, we choose English. We want our child to do well in English, so we choose English. Now, this happens fairly often, and why it happens is for a number of different reasons. First, I think because parents, like most people, think that, wow, one language is hard, two languages must be harder. Well, we know that's not the case, but there's no reason why parents should know that without professional input. So just like they may not have known prior to information from a professional what autism is or what apraxia is, it's our obligation to tell them, well, what dual language development is, what bilingualism is, as it interfaces with the disorder, to tell them both the potential and the possibilities and the benefits of bilingualism, even for a child with a speech or language impairment. So parents may not have this intuitive belief that it won't work, and we can assure them that, in fact, it can. Another source of this resistance is input from other professionals. So it happens more than rarely. Let's say that a pediatrician or a school psychologist or another allied professional tells parents that your child has a disorder, you need to, the bilingualism exacerbates it, causes it or exacerbates it, or whatever, so we need to stick with only one language. So then the informed speech-language pathologist is struggling against parents' intuitive belief and also against allied professional beliefs. So in these cases, what we need to do is acknowledge the good intentions of these prior recommendations, but then proceed to kind of dismantle them based on the evidence that we have available and use the tools. There is information on websites and books that professionals can use to help inform parents about the benefits of bilingualism, even in the face of speech or language impairment.
Well, Dr. Konert, I really have enjoyed our time today, and I'm really happy that you shared your expertise with everybody that's going to watch this video on YouTube.
My pleasure, John.